The African Free Trade Area Agreement, the rise of popular protests in major cities across Nigeria are some of the high points in the continent of Africa for the year 2020.
But every year typically has a defining moment, and January 1st, 2020 marked the start of a brand new decade that many on the continent looked at with optimism and a chance at a new lease of life.
And little did anyone know that the world will be brought to its knees by a public health crisis. It's been 11 months since COVID-19 hit the world. I am Aron Akerejoma.
And I am Adesuwa Omoruan. For the next 30 minutes, let's take a look at what we have already weathered on the African continent.
While it is unclear when exactly the virus was first discovered, it was slow to reach the African continent, with the first COVID-19 case recorded on the 14th of February in Egypt. Africa was deemed a high-risk area by experts, no thanks to the poor health infrastructure. But as the days passed, it soon became clear that while this is one pandemic, it is made up of many stories.
There are quite a number of reasons why the predictions for Africa didn't come true. First of all, the preparedness ahead of the pandemic. Africa had some of the capacities, like the issues of surveillance capacities at the point of entry from previous outbreak, which they actually put in place before we ever got our first case. Secondly, the prompt, or what we call the swift action taken by governments in Africa helped to slow down the progression of the outbreak, starting from the implementation of public health measures, the ability to detect these cases, ability to test and quickly expand this testing capacity, the ability to do contact tracing, isolation treatment, preventive measures by the general population, hand washing, wearing of face masks, the issue of physical distancing also helped a lot in reducing the progression of this outbreak.
A lot of the readings are going to be predicated purely on poor perception, and equally not looking at the very nuances that forge the African economies. I think Africa, unlike most continents, has been able to demonstrate resilience, because our economies, as emerging economies, still have agility. We still are nurturing our democratic institutions. For instance, we're nurturing our business sector. We're nurturing our government's ability to invest heavily into infrastructure. We're forging geopolitical partnerships. So we're still at a very as we are growing, of course, and we're projected to grow even further. What we're seeing is that the reading of this due to COVID was misread, because what they did not factor in is the number of African challenges that we've had to face. We had to face Ebola. So we had to prepare our healthcare systems for that. We had to prepare our economies for that. So we were much more sort of placed to retain a sense of agility from a policy perspective, and equally to have an agreeing society.
There's been a slight increase in COVID-19 infections in Africa over the past few weeks, and according to the African Center for Disease Control and Prevention and the World Health Organization, Africa accounts for just over 2 million of the more than 60 million confirmed cases across the world. There was an average increase of 7.5% in new cases each week over the past month, and this according to the data from the Africa CDC. In the weeks leading up to the 22nd of November, one case rose by 1.2% over the previous week, and new deaths increased by 9% on the previous week. Countries like Morocco, Tunisia, and Algeria are among the 5 countries reporting the highest number of cases. Other countries like Nigeria, Egypt, South Africa, the DR Congo, and Kenya have also seen slight increases, although countries like Ethiopia have seen decreases.
There's a study already done, I think, in Tanzania, where they have shown that 15 to 20% of the people they tested, just a small number of 300, had antibodies to a related coronavirus. The coronaviruses that we know are all over the world, but there are some that are more related to each other than the other. take, for example, the MERS-CoV in Middle East. It's a kind of coronavirus. There are other coronaviruses which cause cold and things in normal human beings. However, I think which coronavirus exists in your place determines whether you have a protection against it. But the study that they've done in Tanzania only shows that there is antibody, but does not tell us whether the antibody is protective. So there are two different things. You may have something that's related to it. You need to find out one that is protective. And so we need to do more studies, not just in Tanzania. In actual fact, there's a study being planned for Nigeria in which they are not only looking at the antibodies to the coronavirus. We are going into archival sera collected 4, 5, 6, 10 years ago, and see what antibodies exist. But go beyond that, whether these antibodies are actually protective. That's the study that will answer that question. But right now, it's a speculation, and we need to do more research than has been done in the African region.
Well, the virus is now spread to every country on the continent, but some are more affected than others. Since the pandemic began, South Africa has had the highest recorded number of cases on the continent, and this is despite the country imposing one of the world's strictest lockdown, including banning sales of alcohol and cigarettes. Although South Africa's high cases have been attributed to the mass testing initiative rolled out by the government in collaboration with private health laboratories. Researchers, on the other hand, suggest the country's high burden of HIV infection and tuberculosis, diseases which compromise the immune system and respiratory health, may just be responsible for its high coronavirus death rates.
In addition to the existing Alert Level 1 regulations, the following additional restrictions will apply in Nelson Mandela Bay Metro with effect from midnight tonight. These additional measures are necessary to contain the resurgence that we are experiencing right now in Nelson Mandela Bay.
From the beginning of the outbreak, South Africa was one of the countries that received most of the imported cases. Along the line, they went into winter, which is another thing. It pushes people back into the homes, and people will begin to gather, of course, in closed environments. And then, but despite this high prevalence or the incidence of the COVID cases in their country, they still manage to slow down the progression. Yes, they are one of the few countries that implemented lockdowns, and we believe that the lockdown measure they implemented had helped them to buy more time to expand the capacities that they needed to expand at the lower level of the health system. And as a result, they were able to manage the outbreak properly.
Although the actual death toll from the pandemic is likely to be higher than the confirmed deaths due to the limited testing and challenges of attribution of deaths, experts are of the opinion that the demographic patterns, urbanization, and comorbidities play a significant role in the relatively low death rates despite the odds against the continent.
Is it possible that we're not finding the true numbers of the pandemic on the African continent? When you look at the death rates, they have remained relatively low. What is responsible for the low death rates? Do we know?
For Africa, what we know concerning the death rate, from statistics globally, the factors that determine prognosis or the outcome of COVID-19 patients are the issue of age and presence of comorbidities. So these factors contribute to increasing chances for deaths. In Africa, we have a young population, and some of these comorbidities relative to what you find in the developed world, we have lower prevalence of these comorbidities. So these are some of the few factors that are known to us that is contributing to the low mortality. But of course, there could be other things that are contributing, but these are some of the factors that we know for now.
With limited availability of the gold standard polymerase chain reaction, otherwise known as the PCR test kits, to detect and confirm presence of the virus, countries around the world battled the biggest challenge at being ahead of the virus through testing, and more testing. Here in Africa, countries faced similar challenges and quickly adopted targeted testing rather than the blanket test for all. Generally, testing on the continent remains low. According to the WHO statistics, tests conducted by South Africa, Morocco, Ethiopia, Egypt, Kenya, Nigeria, Cameroon, Rwanda, and Uganda, as well as Ghana, account for around 75% of the total tests on the continent.
In Africa, countries are testing based on their testing strategy, and they use the capacity they currently have to determine the testing strategy they have. So globally, access to reagents for testing has been one of the challenges for this pandemic. So the countries on the continent try to readjust their testing strategy according to their capacity. But mainly what we know, most of the countries, they test people that are symptomatic for COVID and people that are close contact or positive COVID cases. So widespread community testing is limited definitely on the continent.
The light at the end of the tunnel is an effective vaccine. Vaccines typically require years of research and testing before reaching the clinic. But with COVID-19 pandemic, companies have been racing to develop vaccines as quickly as possible, beating existing records of vaccine development. This is exciting news for the world, but can Africans share in that particular excitement?
This COVAX facility will serve as a channel through which Africa will get this vaccine in a very equitable way. But just to mention that we know from the beginning it's going to be prioritized. So countries have to prioritize who receives the vaccine first, like health workers, people most at risk, before the general population will get the vaccine.
9 out of 10 people in 70 in low-income countries are unlikely to be vaccinated against COVID-19 next year because the majority of the most promising vaccines coming on stream have been bought up by the wealthiest countries, which make up only 14% of the world's population, who have secured 53% of the supply. One of the leading vaccine manufacturers, the Oxford and AstraZeneca effort, says 64% of their doses will go to people in the developing world, but can only reach 80% of the world's population by next year. Now, sadly, 67 low and lower middle income countries risk being left out. 5 out of the 67, which includes Kenya, Myanmar, Nigeria, Pakistan, and the Ukraine, have reported nearly 1.5 million cases between them. To ensure this doesn't happen, COVAX, a massively funded global collaboration involving 187 countries, aimed at helping 92 of the least advanced countries to buy and roll out a vaccine for most vulnerable 20% of the population, was launched. But the initiative struggles with several challenges, including funding.
And continental Africa also had to deal with false claims about COVID-19. With the virus having similar symptoms of other common cold diseases, commonly used preventive measures were being used to curb the spread. Scientific unproven consumption of acclaimed home remedies such as steaming under a blanket to relieve chest congestions, tree barks for dry coughs, inhaling some leaves to clear the nasal congestions, consumption of garlic and ginger became prevalent. But the biggest of such unsubstantiated and controversial cures came in April when Madagascar's president, André Rajoelina, officially launched the CVO, an organic herbal concoction claiming that it could prevent and cure patients of the novel coronavirus.
The economic and health costs to Africa from the COVID-19 pandemic are unprecedented by any measure. With the death tolls rising above 60,000 and more than 2 million confirmed infections so far, the continent has so many reasons to be worried. So far, COVID-19 lockdowns have triggered the first continent-wide recession in 25 years, costing Africa an estimated $115 billion in lost output and pushing up to 40 million additional people into extreme poverty. This is according to the World Bank. Even before the coronavirus struck, Africa was in trouble, with most countries struggling to repay an accumulated $547 billion in debt owed to other countries, multilateral banks, and private lenders. Now, Africa faces a cash crunch. Most national treasurers do not have the money to cover the cost of dealing with the pandemic, worsening the continent's socio-economic challenges. While richer countries have been able to deploy more than $11 trillion to cushion themselves from the impact of COVID-19, African nations are badly in need of resources to provide a robust response and recovery.
But if we were to look at the biggest markets, such as South Africa, for instance, who have, due to COVID-19, who have lost quite a considerable amount of permanent work. And so you find that people that were in the lower middle income base would have now slided into the poverty line. So there'll be possibly, if you're to remove the fact that the government put in a subsidy of 6 months, that will sort of like a social welfare grant to balance things out as families coped with COVID-19. One would then say that if they're moving into that, it enhances the poverty levels within South Africa. Nigeria, we equally saw the same, quite a reduction and sort of like an impact on the economy, which of course job losses. And if you're looking at the fact that we're emerging markets, so we're looking to create jobs rather than lose them. And if more people are sliding back into the into the poverty line, it means that it sets us back in terms of our economic projections. So if you take, for instance, South Africa, the economic projections in terms of GDP growth will have slided down to about 5.1%, with an expected enhancement of that to about 7.9%. So we're going to see, and Nigeria equally is going to be impacted by that as well. So if our biggest players, as well as Kenya, are facing such economic impact in terms of the slowing down of productivity, because during that period the lockdown means that it slows down productivity, which means people have no access to work. So a lot of businesses had to close down. A lot of big projects had to be slowed down. But in the areas such as, some areas didn't suffer as much. So if you look at Zimbabwe, the mining sector continued to project growth. We did a report on a company called Caledonia Mining, which has actually been able to register an increment in its dividend payouts by about 23% this year. And they've been equally able to reinvest about $60 million US dollars into an increment of a deepening of their shaft systems so as to enhance productivity within their mining sector.
But the COVID-19 pandemic goes beyond the health and economic crisis. The pandemic has also posed a leadership challenge. While some were more visible, assuming crisis leadership position, such as the South African and Ghanaian presidents, their Nigerian counterpart adopted a rather silent position, speaking only 1 month after the country's first case, drawing the eye of Nigerians with hashtag #WhereIsBuhari trending on social media. However, his spokesperson described the president's initial silence as a different style of leadership. We cannot also forget those who chose to entertain while passing instructive messages to their citizens, such as the Ugandan President Yoweri Museveni, who admonished Ugandans for exercising outdoors by showing them just how to work out indoors.
So you start by warming up. 9, 7.
The effective response displayed by some African countries could not have been possible without the exemplary roles and contributions of health ministers, health commissioners, heads of country CDCs, religious and traditional rulers, technocrats, and of course, those in the eye of the storm, the health workers.
And just as the COVID-19 pandemic affected ways of life, including educational systems, exposing technological deficiencies in ensuring inclusive remote learning, it also brought with it disruption to elections. From Comoros to Ghana, 18 countries were scheduled to hold presidential, parliamentary, and local elections this year. While some have gone ahead with business as usual, others have had to postpone, including Africa's second most populous country, Ethiopia. So did the coronavirus pandemic in any way pose a threat to democracy on the continent?
Let's look at what the evidence is. We looked at Mali, we looked at Burundi. they continued with the election process.
All right.
Right. And so people still had a voice. We look at Malawi, we look at Tanzania. They still had an electoral process, and the voice of the people was still able to be heard. Okay. What we didn't see, of course, is it's sort of that similar majoritarian approach in which we have massive rallies. They were in pockets of Africa, but the voices of the marginalized governments looked at other ways to communicate. So they adopted technological tools in order to ensure that democracy was delivered. Of course, as young democracies, we can do more, but it is not to then suggest, I'm simply saying that the evidence suggests that there is a silencing of democratic processes in Africa is not the case. We have 4 to 5 case studies to look at. Even if we look at Ghana just yesterday, we've been able to get a result. And what we can say, actually, is that for the first time in African elections, we did not have external observers, and there was no chaos.
In spite of the challenges posed by the pandemic, it created opportunities for young people to innovate and create local solutions. Young people in different parts of the continent provided low-cost solutions to the crisis, from locally built ventilators, disinfectant cubicles, to low-risk, effective water dispensing points. No doubt, previous crisis navigation and the resilience of the African people to innovate and adapt was a plus in weathering the COVID-19 storm.
Well, the year 2020 has tested the resilience of the African people on all fronts, with social, cultural, and economic impacts that will be felt for a long time to come. Nevertheless, as the world begins to plan towards a post-pandemic era, no doubt the COVID-19 pandemic has left us with life lessons.
It also highlighted the uniqueness of the African people in the terms of innovation and collaboration between the public and private sector that bettered COVID here in Nigeria. But worryingly, it also highlighted the fragility of our economic and health sectors, as was witnessed in the course of the pandemic. So always remember
to wash your hands or use a hand sanitizer,
keep social distancing,
and of course, wear a face mask.
Yeah.